All right. So Roger, how long have you been with Wheaton?
I have been with Wheaton for 11 years.
11 years, okay. Are you familiar with the What Great is Made Of campaign that has been out in the communities for the past several months?
No, I'm not.
So much, okay. We launched this last fall around surgical, and now we're giving it legs and extending it. In the last couple of days, we've been talking with Wheaton Associates about what makes Wheaton great.
Okay.
And just kind of getting some comments on the organization itself and,
All right.
and patient experiences and such. What made you decide to get into healthcare?
It is a long, complicated story. I actually was in the military for 10 years, and I worked in aviation of all places, but I got out after 4 years of active, 6 years of National Guard. I was in college while I was in the Guard, but I didn't really know what I wanted to do. Started taking some gen ed courses, found out I was really good at chemistry. My wife went to Iowa also, so I transferred down there and applied for the pharmacy program, and the rest is history, and here I am. So.
Wonderful, wonderful. What would you describe a really good day on the job?
A really good day?
Mm-hmm.
Probably a really good day here is when everything flows smoothly with little insurance issues. I mean, I always tell everybody I love my job. I am actually a people person. I love working with the community. The one thing that I don't like is actually collecting the money for the meds, but I realize that's a necessary thing that we need to do. But in this job, you deal with a lot of insurances. So a good day is when we don't have a lot of issues in that area. So.
Sure. Absolutely, absolutely. I would think, especially being out in a rural area like this, that you do develop patient relationships.
Oh yeah, that's the best part about working in a small community is you get to know the people very well. I know just probably about 99% of the people that walk in that door I know them by their first names, and they know me, and that's the best thing about working in a small community is getting to know all the people.
Absolutely. Is there any one just remarkable story that has been inspirational to you of an individual that you know that maybe had an issue that was insurmountable, and perhaps even the health and assistance they received through Wheaton helped them get over those hurdles? Anything come to mind without naming any names?
Not really.
Not really? Okay.
And that's not helpful, I realize, but
no, that's okay.
I mean,
that's all right.
I can't think of one off the top of my head.
Sure. Not a problem.
I mean, I think just being out here in this community is a help. I mean, I think what Wheaton does by having the clinic and the pharmacy out here in this community itself as a whole is a great thing for the community. So, I mean, to pick out just one individual, I can't do that, because I think just the clinic and pharmacy itself helps the entire community by being here. It really does.
Absolutely.
So.
Absolutely. Excellent. Is there one particular person maybe that's been an inspiration to you in your career in healthcare over the years, or?
Like I said, I can't say there's one individual. I come to work every day and just do what I can do to help people, and I think that the doctors that work out here at Jessup, that's who I mainly interact with. We've got some good doctors out here, and Dr. Feldkamp is a really good doctor, and I think the community really looks up to him and are real happy to have somebody like him in the community. So, things like that. I mean, it's just the everyday things that, So to pick out one person, no, I can't do that. But
sure, absolutely. If there were one thing that, speaking of Wheaton as an organization, that just really makes Wheaton great, or collective thoughts, either way, can you maybe encapsulate that a little bit?
Well, like I said in one of my earlier comments, the thing that I think that makes Wheaton great is I work in a rural area, and I think just having these small clinics in rural areas where people have trouble. I have elderly people that come in here that would have a very difficult time getting into in town. You know, they come in here. I got some people who are in Coumadin that got to come in once, maybe sometimes twice a month, to get their blood work checked, and it's difficult for them to get into Waterloo or even over to Independence. So, you know, I think that helps. Also, we have a delivery service. Once a week, we deliver to the shut-ins at Fairbank. Their prescriptions, you know, otherwise they would have a difficult time getting their meds. So it's just stuff like that. The little things, you know, the delivering to the shut-ins, you know, and maybe it ain't one of those things that the whole community sees, but the people who do receive it, I know, are very grateful for having them kind of services. So.
Very good. Very good.
Maybe a question about, is there a way to talk about maybe integrated care in some way? Do you work with the people is it just the doctors locally that you work with, or do you work with?
Oh no, I get prescriptions from a lot of prescriptions from Waterloo. We're a huge retired John Deere community out here, and with the way the contract is set up right now, they see a lot of doctors in Waterloo, but they bring their prescriptions to me because I can fill their prescriptions. So I work with a lot of doctors as far as, you know, what my patients bring in for prescriptions. And then of course there's the O-line doctors, the independence doctors, and of course Dr. Felgamp, he's our big provider here, I mean, as far as writing.
And one huge attribute that we're addressing in the upcoming campaign is the fact that Wheaton has such a vast network and presence, and that how it is so helpful getting people into the Wheaton pipeline out in the rural areas, and then the access to care that they have on the other end.
Right, right. Exactly, like the stuff that they can receive from the hospital or the test, and making sure that they receive the things that they need. You know,
Yeah,
being out here in the rural area, that's a difficult, especially when you're an elderly person living in the rural area.
Well, convenience is really, I mean, you can't expect to have too much convenience, I would think, in more of a rural area. I guess unless you're used to it, and then you
Right.
live in a small town, so you don't think about that. But.
Right.
Yeah.
Yeah. So.
Awesome. No, I
Yeah.
think we got some really good
Yeah.
stuff.
Okay.
Very good.
All right.
Very
Thank you.
good. Thank you, Roger.
Hey, we lucked out. Nobody walked in. You know, I'm gonna